Betnovate ointment is a GC for external use. It has anti-inflammatory local, anti-allergic, anti-edematous and anti-proliferative effects. Systemic effects are significant due to limited absorption through the skin. Active ingredient betamethasone. Indications for use: atopic dermatitis, diffuse neurodermatitis, contact dermatitis, simple and allergic, simple chronic lichen, limited neurodermatitis, exfoliative dermatitis, urticaria, dermatitis herpetiformis, seborrheic dermatitis, notochorosis gaida, eczema, psoriasis, lichen planus, skin itching, discoid lupus erythematosus, generalized erythrodema as part of complex therapy. How to use: a small amount of cream is applied to the affected areas of the body 2 to 3 times a day and gently rubbed. After the appearance of the effect, the frequency of applications is reduced to 1 to 2 times a day. Children are prescribed 1 time per day. In the case of the severe hyperkeratosis, psoriatic plaques on the elbows and knees, the Betnovate effect can be enhanced by applying occlusive bandages to the affected areas with plastic film only at night, and when the condition improves, maintenance therapy is carried out with regular applications without bandages. In the absence of regular medical supervision, the course of treatment should not exceed 7 days. In children and in patients with lesions of the skin of the face, the course of treatment should not exceed 5 days. Contraindications for use: hypersensitivity, skin manifestations of syphilis, lupus, bacterial, viral, fungal skin diseases, trophic like ulcers associated with varicose veins, skin cancer, nevus, apheroma, melanoma, hemangioma, xanthoma, sarcoma, rosacea, acne vulgaris, post-vaccination skin reaction. In children under 1 year old, a rash against the background of diaper rash, viscousin, pregnancy, with prolonged use or application to large surfaces, cataracts, diabetes mellitus, glaucoma, tuberculosis. Special instructions for admission: avoid contact with eyes and mucous membranes. In the case of using the drug for acne vulgaris or rosacea, an exacerbation of the disease is possible. Side effects: burning, pruritus, steroid acne, stria, dry skin, folliculitis, hypertrichosis, malaria, secondary infections of the skin and mucous membranes. With prolonged use, skin atrophy, local hirsutism, telangiectasia, papero, hyperpigmentation. When applied to large surfaces, systemic manifestations, gastritis, ulceration of the gastrointestinal mucosa are possible. Overdose symptoms, manifestations of hypercortisolism. Treatment: symptomatic, gradual withdrawal of the drug. If necessary, correction of electrolyte balance.